Okay, so welcome to the channel members, and today with me is Dr. P.K. Jain, who is the chairman of Critical Care Education Foundation. And the purpose of today's video is very special. There were many requests on the ESBICM society and the ICU channel that members and the viewers want to get trained in critical care. They were looking for certain critical care courses from us, and as we know that we provide free education to each and every viewer or each and every member of the society, which are spread across the world. So on request of all of you, we get associated with Critical Care Education Foundation, and we discuss the requirements and we discuss the details of the requests which we are receiving. And I'm very fortunate to welcome Dr. P.K. Jain, who is my mentor, you can see godfather in critical care of mine. And we have discussed, and we are here to give you some information regarding the critical care courses which sir has modified especially for the members in India and across the world. So welcome, sir.
Thank you. Thank you very much.
As you all know me, myself Dr. Ankur from ICU channel ESBICM, and now I'm also a part of the Academic Council of Critical Care Education Foundation. So sir, thank you for sparing time. I know you are very busy with the exams, the fellowship exam which is going on. So my question is, what are the various courses which CCF runs at this moment?
Okay. That's a very good question, Ankur. We run a few formal courses, which is the FCCCM, that stands for the Fellowship of the College of Critical Care Medicine. It's a very popular exam. And we have now recently introduced the Advanced Fellowship in Intensive Care, because India is now competing globally in terms of its knowledge and expertise and what it can contribute. So this is more in tune with the international standards. And then we have the IFICM, the International Fellowship of the College of Critical Care Medicine.
It's a foundation course, international foundation course in intensive care medicine. This is especially on the request of the members who are overseas. So just to give you a little bit brief about CCF, which we were discussing. So the CCF was running this fellowship course FCCCM for long 20 or more years now. It was based on the Australian and New Zealand pattern, which was international exam. Previously, the examiners were also for 10 years. They came and evaluated and seeing the standards of the exam. Now it's self-sustainable. It was a 2-year exam, part 1 and part 2. And now what we were seeing that the difference in the part 1 and part 2 exams have grown tremendously. The gap has increased. I think the part 2 exam is more advanced version of the fellowship. So advanced fellowship, which has started this year, it separates these courses. So we have FCCCM, which is the entry level exam. Means it's also already advanced version, but it is Sherlock Holmes approach. It gives you an idea how to approach the exam. It's a 1-year fellowship exam, FCCCM, Fellow of College of Critical Care Medicine, and we will discuss AFIC and IFICM also. Sir, so my question is, who can apply? What is the eligibility of FCCCM?
Well, the eligibility is they have to be a practitioner of modern medicine, which we in India refer to as MBBS, Bachelor of Medicine and Bachelor of Surgery. But globally, there are various names that they may be there.
Equivalent to MBBS.
Equivalent to this. It's they practice allopathy, what we call allopathic system of medicine or the modern medicine. And they need to have worked for 1 year in ICU.
ICU experience 1 year.
Yes, because unless they work there, how will they decide whether they love this specialty and they want to make it a career? So I think that's why they need to have worked for 1 year, and that's when they're best suited to learn what we teach.
And they get exposure of the critical care. And so this FCCCM is 1 year duration.
Yes.
So eligibility is MBBS equivalent with 1 year of ICU experience.
Yes.
Now, sir, where they can apply? Is there any institute recognized, or is there any?
Initially, we had this concern, and we had a criteria laid down, and many institutes applied for recognition. Almost 250 institutes they were inspected, and then they became their doctors working in those ICUs could appear. But India is a very big country, and we were flooded with requests from cities which we had not got a training center in. And so the College of Critical Care Medicine, which comes under the Critical Care Education Foundation, it stepped in and said, we are going to teach from the college itself.
The teaching was centralized.
Yes, got centralized and online, so that these Zoom meetings could be heard by doctors all over the country and even abroad without having to take leave or to travel all the way to Bombay. And that made a big difference. So there are, couple of times a week, there are programs running, and there are live programs. Students can then interact with the teachers.
Earlier, there was one problem which was also coming from the recognized institutes, was that because the demand of intensive is so much in India, even in the across the nation, world, that they switch very frequently. And when an institute get recognized, there is a teacher, and the teacher shift, then the candidate which is there that suffers, goes through difficult tasks. So
Yes.
that becomes a challenge.
I'm happy that you brought this point up. You see, the hospital ICU got recognized because of the intensivists and their ability to teach. But in a year or 2 years, they would be picked up by another hospital, maybe a bigger hospital and a bigger paycheck, and they would leave. So that left the institute in a difficult situation where they had students, but they didn't have a teacher, so they would get automatically de-recognized. We have now stopped this recognizing institutes and made it doctor based. So if you're a teacher, if you're an intensivist and you can teach, it doesn't matter which institute you're in, you can then continue teaching there.
So basically, there are certain late criteria for an institute, like number of beds or the ICU, the multidisciplinary thing, which are there on the College of Critical Care website. So if you are working in an institute which has 24-hour intensive care and fulfills the norms laid down by the college, you can continue working in your institute and you can apply. When you apply, there is a section where you will find the list of teachers. If you know them, if they are in your city, you can contact them. And if they agrees to mentor you, you can continue in your institute and you can be in touch with them. So you can get a teacher or mentor there. Even if it is not available, neither in the institute nor the teacher is available, you can still apply for this FCCCM course. The only thing is you need to be serious with the centralized teaching which the college takes throughout the whole year. And if you study hard, you learn the critical care, you need to appear for the exam and you can go with that. So this is about, sir, what is the fee structure?
The fee structure is actually available because there are various fee structures, international, national, etc.
So
they're available on the website of the college. That's
okay, so
collegeofcriticalcaremedicine.com.
So you can go to the collegeofcriticalcare.com because it's a variable thing. So you can just go to the website and have a look. So for FCCCM, MBBS plus 1 year of ICU experience, you can apply from whichever institute you are working. You need to have certain criteria fulfilled. At basic ICU
Yes,
should be available.
It shouldn't be a very basic nursing home where you're not exposed to any of the new techniques, etc. And so that wouldn't be
good. So on the website, the details are available.
Yes.
And there is no exemption for FCCCM. It's a 1 year thing, and anybody who is graduate or postgraduate, they need to complete the 1 year. Now, from this year, I think the advanced level of fellowship, advanced fellowship in intensive care, so the another course which you were discussing is going to launch. So why the need for advanced fellowship in intensive care, which we call as AFIC now?
You see, previously when we started, we had the primary exam, which was part 1. It was called the PCCCM. And then the second year of the final exit exam was the FCCCM. They were very similar, except that for FCCCM, the candidate needed to know more in depth. Okay. So PCCM was assessing you as a good registrar level, and FCCCM was assessing you as a consultant, but the topics and skills were very similar. The College of Critical Care Medicine is a very dynamic institute, and it incorporates the good things in it. So we, for example, incorporated medical statistics, paper publication review, and critical appraisal,
USG,
hemodynamics, ultrasound, echo, their research. So as we've added these to make our course comparable to the international courses, or maybe even better than the international courses, the difference between the level of primary exam, the PCCCM and FCCCM,
has gone very high.
Not only increased the gap, but both of them actually evolved. And after few years, we realized that the primary exam is actually what many years back, 10, 15 years back, was
a fellowship exam.
Yeah. So the fellowship exam, both of them have evolved so much that the PCCCM is actually now on par with the old FCCCM. And the FCCCM has now got so advanced that we decided to just change the nomenclature and call it the Advanced Fellowship in Intensive Care.
So the first course was FCCCM. The second is Advanced Fellowship in Intensive Care, which we call as AFIC as a short form. And now those who have cleared, sir, so eligibility criteria for AFIC is those who have cleared FCCCM?
FCCCM. You see, FCCCM is, trust me, a very unique, beautiful, eye-opening, life-changing course.
Right, agree.
And if you, there is no other course comparable to it. And that's why a lot of the Sherlock Holmes approach, etc., is part of the FCCCM. I believe that if a candidate, even if they're MD, or they've got 5 years post-MD experience, or they've got 15 years ICU experience, etc., unless they do this training, their life really doesn't change. They just become one more person who's got a critical care degree. After doing the primary, which is now the FCCCM exam, they really become very strong in critical care medicine, and then they go for the advanced. So the topics covered are very different, the subjects are very different, and so there is really no exemption. Everyone has to do the FCCCM.
Okay, so AFIC can be applied by only those candidates, those who have cleared FCCCM.
Yes.
Eligibility criteria, and again, you can apply from whichever institute which we discussed. The eligibility criteria remains the same, and institution and teacher criteria also remain the same from whichever institute. The fee structure is also available on College of Critical Care website, and you can go through them. Sir, just want to ask, for FCCCM and AFIC, how is the exam, exit exam conducted? Means exit exam at the end?
They are physical exit exams there. But there are two more things, that when a candidate registers for the FCCCM exam, within a month of the closure date, they actually have a 4-day contact period where from morning to evening, they're taught the approach to every problem that they would face in the intensive care unit, at least the common ones. And that is eye-opening because it is so different and so practical and so empowering, these lectures, that you become very confident when you practice in the unit. We call this the orientation program.
Okay.
And then there is the online teaching, so they don't have to travel. Then 1 month before the exam, we have like a mock exam and a crash review of the important topics, so it's like a refresher, and the theory exam is held at that time.
Okay.
So, and after a month, they have the practical exam, which is again a very unique
different
exam that we have. Yes.
Very different. Orientation is done for AFIC, and crash course also done
Both,
for AFIC.
yes.
So it is in the AFIC also.
Both
AFIC. But both the exams have their exit exam, physical one, in India as of now. Sir, now coming to the third exam, which is going to be launched, I think in the first quarter of 2025. and it is, I have very much regards and thanks to Sir P.K. Jain Sir and College of Critical Care. It is actually based on the request which the CCF has received, and also the request received by the ESBICM members, the ICU channels. We have members from across the world who wants to get trained in intensive care, both developed and developing countries, but the only problem which they were facing is to travel to come to India and give the exam was a bit difficult. So, sir, can you give some light on the third exam, which is International Foundation Course in Intensive Care Medicine, which is IFICM?
Thank you. Yes. For the past few years, international students have been registering for our FCCCM exam. We've had candidates register from Florida, USA. We've had them from Africa. We've had them from many other neighboring countries. But invariably what was happening is that for the exam, many of them were not getting leave from their institute. And so they were losing out on giving the exam, they were losing the fee which they had paid for, etc. And what we realized is, after speaking to them, and now we have in the college council, we have a lot of overseas representatives as part of the college from different countries who are giving inputs representing their own country's need for critical care. So Ethiopia, Nigeria, Bangladesh, Pakistan, Sri Lanka, many of these places, Vietnam, Taiwan, and they have been writing to us they want this Sherlock Holmes approach, they want this teaching that is very unique and very empowering at the bedside. So we're devising a foundation course. It is a fairly basic course, but good enough for you to be a good doctor in the intensive care unit. But it will be totally online. The teaching will be online, the assessment will be online, and it will be a 1-year course. So you don't have to travel at all.
That's a big boon, because you can appear for this exam from your own country, from whichever institute you are working. It's an online course, and exit exam is also online, and you will get IFICM, which is, its name is foundation course, but believe me, your foundations will get very strong when you go through this course. It is being designed, the whole team is working on it, and we are working to launch it very soon. And I immensely thank Sir and Critical Care Education Foundation for considering this request. And I hope in the first quarter of 2025, enrollment will start. So IFICM.
And the other good thing is that, unlike the FCCCM and the AFIC exam, where the registration is fixed once in a year, for the IFICM exam, which is totally online, you can register throughout the year.
Anytime.
And the exit exam will be 1 year from the time you registered. So you could register virtually all 365 days of the year.
The reason behind this is because the conditions in every country is different. The session years of the medical students, the teaching pattern, and various logistics are very different in different countries. So we decided that it will be, you can register anytime, and from the date of registration, after 1 year you can give the exam. So IFICM is going to be launched very soon. So FCCCM, AFIC and IFICM, these are the 3 courses which the CCF runs as of now from the calendar year 2024 and 25. Now, sir, one question which I think members should also know, that these are the medical students who are either in the early phase of the intensive care or want to get into the intensive care, or there are 5-6 years or 7-10 years in the intensive care. There are many professors, many big teachers, many people, those who have a lot of experience in intensive care. Like they have been assistant professor or professors in medical colleges, and their work experience is way beyond more than 20 years. So is there a way for them to get certain recognition in intensive care from College of Critical Care, or they also need to appear for the exam if they want to pursue?
Well, we've had very senior professors and heads of institutes and private hospital heads give this exam, but it is not easy. You have very often your own students appearing for the exam and you appear for the exam. It becomes a little embarrassing at times. Plus, the huge number of hospitals in India, the huge number of physicians who want to train is pretty overwhelming to have. So what we've done is that they've already are post MDs. So the University of India, the Indian University, has already examined them and certified them fit for an MD level. It's just that many of them are from anesthesia or medicine and they don't have formal training in critical.
And they have a lot of experience of 20-25
years.
Yes,
they do. So recognizing that if they've got more than 10 years of experience and they feel that their commitments to the institute, to the family, etc. is such that they cannot spare 1 year away from the job and family, we have an honorary FCCCM,
okay.
Which just recently 3 professors from medical colleges, government medical colleges, requested us that they don't have formal training and it becomes little embarrassing to be a professor of critical care or associate professor of critical care just because you're medicine or anesthesia and you have no formal training. So what happens is that they fill up a very detailed form where they talk about their skills, how they handle situations and scenarios that are given, and accreditation team of the College of Critical Care goes through them, and once they provisionally approve the qualification and the experience and the skills, there is a online interview process, and the interview process, a panel sits and evaluates. It's very important to get to know each other there, get to know the experience that is there, and the final phase is that they are required to give 2 PowerPoint presentations on a critical care topic so that the committee can evaluate the teaching skills, etc. And they're given. So we've actually finished this process for 3 professors in India.
Just to clarify that the work experience which the sir was talking, it's the experience in the critical care medicine or critical care department which will count, but details are available on College of Critical Care website and anyone interested can go through it. So this were in short about all the courses which CCF runs. Again, FCCCM, AFIC and IFICM, which is going to launch very soon in the first quarter of 2025. So thank you, sir, for this session. And I'll have some more questions, but that we'll cover in the next session, next video.
Thank you very, very much. And it's nice because of Dr. Ankur, so many doctors from all over the world have been able to communicate with us and tell us their difficulty and their needs there. And we're working with many countries now with their intensivists and professors of intensive care to share our experience and learn from them in an appropriate way, and we teach them and making the world a smaller place.
Okay, thank you. If you have any query regarding any of the courses, obviously you can go to the College of Critical Care website, collegeofcriticalcare.com, or you can write to the college at office@ccf.in, office@ccf.in. And obviously, if you want to communicate with the channel, it's ICU channel at ESBICM.org. Thank you. See you soon in the next video with sir for some other questions I need to ask. Thank you, sir.
Thank you.